Our office now offers kind of a novel treatment, which is called Iovera, and Iovera uses something called cryoneurolysis, which is basically targeted cold therapy to peripheral nerves in our patients' legs. We use it specifically for knees alone. And the way that it works is a needle is placed into the leg under ultrasound guidance around a peripheral nerve, and then the cold kind of degenerates the signaling part of the nerve, giving you around 3 months plus of pain relief without impairing motor function. There's really 2 patients that it's best for. The first patient is a patient who has tried other treatment modalities, be it injections or oral medications or bracing, and is either too high risk for surgery or really is adamantly opposed to surgery and having knee pain in the front of their knee. That is a great patient to try this with. 2 weeks or more before their knee surgery, we'll do this procedure on them, and it gives multiple benefits. 1 being they have less knee pain before the surgery, and 2 being because we make the incision on the front of your knee, you don't have as much knee pain after surgery. And there's good literature to support less opioid, narcotic type pain medication use after surgery for patients who have had this, as well as a quicker return to their better range of motion and physical capabilities.